Good morning, Stu. What's going on with Boston? That was a hell of a game.
Yeah, I hope it's not a sign of things to come, Bernie. Hey, the first three games went to overtime, and last night's game almost went to overtime, Tampa and Florida. So it's close hockey.
I look how spirited that game was and wondering if Toronto can play in the same arena.
I don't think Toronto will have much trouble in Montreal. I really don't.
Anyone heard from Councillor Huffman?
Mr. Chair, I have not heard from Councillor Huffman.
Okay.
I don't know. Kristen, have you?
No, I haven't either.
Good morning, Councillor Huffman.
Good morning.
Mr. Chair, I don't believe we're expecting anyone else this morning.
Okay, and it's 9:30, so we'll call the meeting to order. Are there any disclosures of interest? Okay, I see no hands. Additions to the agenda. We've had 4 items under other business that have been added. There was a revised schedule sent out. Adoptions of the minutes from the April 19th meeting. I should ask here, do we actually need a mover to accept that? That's just a notification as to whether or not they were all the motions were adopted. Is that, or would staff motion here to receive this?
Mr. Chair, I would suggest that if we could do a motion and seconder to receive as information or to include any corrections.
Okay, then I have Councillor Corbett that's moved and a seconder. Councillor Taylor. All those in favor? It is carried unanimously. Update on reports from the April 19th meeting. Heidi, is there anything you want to notate here?
Mr. Chair, those reports were presented to Counseling Committee last Tuesday and are scheduled to be ratified by Council tomorrow night.
Okay. Okay, then we'll go right into staff reports under the General Manager section. Heidi, is there anything you want to mention here?
Mr. Chair, I will do the COVID update on behalf of Dr. Nassatari and the health unit today.
Okay.
So in total, we have, since the beginning of the pandemic, we have had 2,553 cases of COVID. Over the past 7 days, the 7-day rolling average has been 12.43 cases per day. This is down from approximately 19 the previous week. Our epidemiologist is noting that we are seeing more of a plateau in the number of cases than a true decline. And so it is incredibly important that people continue to follow public health measures. I think that that's consistent with what we are seeing in the province as well. We have had 8 new cases in the past 24 hours. And we continue to see a number of cases that have the mutation for the variants of concern, both the UK variant and the Brazilian variant. And so that, of course, is incredibly concerning because of the increased transmissibility of the virus that contains those variants. And in fact, more than half of all cases since the month of March have involved a variant of concern. We're currently managing 4 active outbreaks, 2 on farms and 2 in workplaces. We have no long-term care outbreaks at this time. And of course, with schools being part of online, entirely online, we're not seeing, we're not having to isolate school cohorts. In relation to the vaccination program, there have been over 48,000 doses of COVID-19 vaccine administered to date, and approximately 4,000 doses within the last 7 days. There are approximately 51 people who have completed their vaccination series, meaning that they have had second doses. So to date, approximately 40% of adults in Haldimand and Norfolk have received at least 1 dose of the vaccine. In terms of the vaccinations, we have seen considerable policy change within the recent days related to the pausing of the use of the AstraZeneca vaccine because of the risk of a vaccine-associated blood clotting syndrome. Locally, AstraZeneca was only administered through the pharmacies, so that's currently on pause. We're waiting for further direction from the province related to the continued use of, or when that's going to pick back up for the use of the AstraZeneca, as well as address the need for second doses for people who received AstraZeneca as the first dose. The second policy change has been to prioritize healthcare workers for a second dose in a shorter time frame than the 4-month dosing interval. And then most recently, the change in direction to include youth who are between the ages of 12 and 17 as eligible for the vaccination. So we're just currently planning for that new direction related to youth, and we'll have increased communications about that coming as soon as we can. The provincial communication has been that youth are eligible as of May 31st, and the province is looking to do a targeted approach to vaccinating that population mid to end June. We continue to work with our partners at the Mississaugas of the Credit First Nation to vaccinate their community, and that's been going well. And we are also continuing to work with our agricultural community to vaccinate our temporary farm workers as they come out of isolation if they had arrived before the federal vaccination program at the airport. So I think that is all I have for the COVID update, Mr. Chair. And with that, I'd be happy to answer any questions.
Any questions or comments for Heidi? Councillor Huffman.
Thank you, Chair Del Monte. Through you to Heidi. In regards to the TFWs, how many would be remaining that would need to receive the vaccine?
Thank you, Mr. Chair. Through you to Councillor Huffman. I may need to get back to you with an answer of numbers. I can tell you that in terms of the number of individuals that we have vaccinated, it's been nearly 1,300. And I want to say that there were about 2,000 workers or more who had arrived before the federal vaccination program started. But I would need to connect with Sarah Page, our vaccine coordinator, to get that specific number for you.
Heidi, just a question for you. I've had some calls from people who have had their first dose and are waiting to be contacted on their second dose, and then others that went in and had a second appointment booked on the spot, and that created a little bit of confusion, I think. Are we making good progress on contacting those folks who, who were contacted first and went for their first shot and are now waiting to be contacted again? Are we making good progress there?
Yes, Mr. Chair, thank you for that question. So there are in relation to second doses, there are three things that are happening simultaneously. So the first group of people are individuals who received a first dose and who are eligible for their second dose within 4 months because they don't have a high risk health condition. Those individuals booked their first dose through our local booking system, and health unit staff are currently working through that list to book the second dose. The dosing interval for those individuals is 4 months. We are contacting them at the 90-day mark. That's the 3-month mark, so that there is some room if people, have a cold or have had another injectable medication, that there's going to be a delay in their second dose, to make sure that we've got a bit of a window to ensure that we're not booking people at the last minute so that we can't get them in within that 4-month dose interval. So that's group number one. We are contacting those. We have a list. We have it by date, and we are contacting them every day to book their second dose. The second group of individuals were individuals who booked their first dose through the local system, who have a high risk health condition as defined by the provincial prioritization framework. Those individuals, like people who have certain types of cancers, who are actively receiving chemotherapy, who have a certain high risk level of kidney disease. It's very specifically defined by the province. Those individuals, the guidance document was that they are to get their second dose within the 21 to 28 days. And so when they had their first dose, their second dose appointment was booked at that time. And if it wasn't, we are catching them through our system to make sure that they get their second dose within the recommended 21 to 28 days. So that's where some people were, yes, they were leaving a vaccination clinic after a first dose with a second dose appointment. But that is because they fell within that defined category. Okay. The third group of people are the people who have switched to the provincial booking system. The provincial booking system automatically, when you book your first dose, books your second dose for you 4 months out, unless you have a high risk health condition. So in terms of the second doses, like I said, we have three things happening simultaneously, but we have very dedicated staff and a very good tracking system, and I am confident that we are not missing people for their second doses.
Okay, thanks, Heidi. That helps a lot. Councillor Corbett?
Yeah, thank you very much. Just a question on our screen here. I raised my hand. I don't see it raised in my picture. Can you see it when it's raised?
I can, Bernie, yes.
Okay, thank you very much. And thank you, Heidi, for the very informative outlay of what's going on. I'm very complimentary, and I've heard a lot of comments of how the program is being rolled out in our community. And I'll go back to the question again I had last time. I know that we have people, for example, in the pharmacy in Dunnville that are from out of town. And I know that our community has a lot of people who are getting their vaccination outside of the community. How do we keep track of the total number? Or are we just saying that the number that are vaccinated in our clinics, and it doesn't give a true picture of actually how many are vaccinated? Thank you.
So, Mr. Chair, through you to Councillor Corbett, thank you for the question. So when the pharmacy program is a provincial program. So that means that people anywhere in the province can book a pharmacy appointment anywhere in the province. The provincial booking system works similarly. So that allows for people who, for example, live in Brantford but work in Haldimand and Norfolk and spend most of their time here to book a vaccination here. Our epidemiologist is part of the statistics that she keeps, is related to and reports to the province, is related to the vaccination rates for Haldimand Norfolk residents. So the data that I gave you and the data that appears on the health unit website related to the percentage of the eligible population vaccinated is accurate for Haldimand and Norfolk. So we are at the right around the 40% mark of our eligible population, which at this point is the 18 and older. So what I can't tell you today, though, Councillor, is, the percentage of people who live somewhere else who have been vaccinated here, but I would suggest that it's minor, and it has to do primarily, again, this is my assessment, but it has to do with the fact that people spend they might live somewhere else, but they spend a lot of time here, particularly for work. I don't think we're seeing a lot of the vaccine shopping that we hear about, right? Where people kind of look around from community to community looking for vaccine.
Are there any other questions or comments? Okay, then we'll move to the reports. So the only staff report here is on page 7, report HSS 2108 regarding the social assistance transformation.
Hi, thank you, Mr. Chair. I'll present this to the committee, so through you to the members of the committee. In February, and then stated in March, and then again updated recently, the Ministry of Children and Community and Social Services has released a vision statement, so a social assistance transformation or recovery and renewal plan that will see changes occurring in social assistance service deliveries through to 2024, when the completed pathway has been managed, and that we're at that full phase of what service delivery will look like. Staff don't know the full scope of the changes at this point, so the information is being provided to give you the content of what we do know. And what we see through the vision statement of transformation is that the province will more fully take over the centralization and administration of the financial aspects of social assistance. So for those who are receiving Ontario Work and Ontario Disability Support, the province will take over the financial eligibility and administration piece, leaving the municipalities to continue to deliver life stabilization, service navigation supports. So those would include appropriate referrals to employment, appropriate referrals and support for mental illness, addictions, housing, children's services, and so on and so forth. So we are in a state now of seeing some of the changes. As you know, Haldimand Norfolk is a prototype site within our province, and so we have begun the employment services transformation already, and we are also part of the prototype for central intake. And so the changes that we are already experiencing have not yet happened in some of the other service agents, other municipalities. And so we're a little bit ahead of the curve, as we were chosen for this to be a prototype area. So the changes that we are seeing is that our staff are already focusing more on life stabilization supports and on more holistic type support. But what we know is that work will continue, and that we'll need to become better at providing those integrated supports and services to our community members as this rolls forward. So in summary, we have some information. We know there are a number of changes that have already occurred, and we know there are a number of changes to come. We don't have the details on all of the changes that are before us, but we do know that the pathway is set to be in place for no later than 2024 across the province for all municipalities and provincial service delivery. That's it in summary. I'm happy to open it up to questions.
Okay, thank you, Stephanie. Are there any questions on the report? Councillor Corbett?
Yes, thank you very much for the report. I'm looking at a funding reduction of 682,000 and wonder how that rolls out in terms of our administration staff. How does that funding work out administratively for us?
Thank you. Through you, Mr. Chair, to Councillor Corbett. So the budget reduction, one of the impacts of that is that we have reduced funding to provide employment-related funds or employment-related funding supports to our clients because our clients are now being served through our Employment Ontario providers. So part of that employment services transformation meant that we aren't doing that employment-related support anymore. And so the budget reduction did come about that we have less funds for those. And so our employment services providers are taking that function of services and support on. We've also had some reduction in our staffing complement, which I know was brought to council and was approved and understood that some of the vacancies that we had were not filled. For example, one of the positions that was not filled was a program manager position. Another position was an employment and community placement coordinator, who's very much related to the employment support. And so that position was no longer part of our portfolio, was therefore not filled, and therefore created some of that budget reduction on our behalf in terms of the changes in our budget. Does that answer your question, Councillor Corbett? Awesome. Thank you.
Mr. Chair, could I just supplement that a little bit? Yeah, I do want to advise committee that our initial experiences with the employment services transformation are that the level of benefits that Ms. Rice described that we used to deliver, our clients are not receiving the same level of benefits in the transformed employment services. So there is it is our assessment that there is a loss of support to those clients, that there is not as much ongoing employment related support for them. And on the FTE side, in total, Ontario Works has lost 4 FTEs this year.
Okay, thank you, Heidi. So I see no other hands. The motion is to receive the report's information on page 10. Can I have a mover for the motion, please? Councillor Huffman, second by Councillor Taylor. All those in favor? I don't see Councillor Patterson, so the motion is carried 5-0. Moving on in the agenda, items, are there any questions on the 3 items listed under communications? See no hands, so can I have a motion to receive those items as information? Moved by Councillor Corbett, seconder. Seconder for the motion, Councillor Huffman. All those in favor? Again, it is carried 5-0.
Mr. Chair, could I just ask committee members, historically we, at times we have had a member of advisory committee attend the Alpha AGM and conference. So if there are any advisory committee members who are interested in that, could you please reach out and let me know, and we will support you to get registered. And we support that through the health unit administration budget.
Okay, thanks, Heidi. So we'll move into other business. We have 4 items listed. So the first item is the advisory committee schedule. Heidi, did you want to speak to that?
Certainly, Mr. Chair. So this was an item that was brought up to myself and the Norfolk County Clerk by Councillor Van Passen. And so I had indicated that we would add this to the agenda. I don't want to speak for Councillor Van Passen, but I will introduce this item and then pass it over to him for any additional comments. The concern was that with the schedule that we are at right now, there is a significant delay between the time reports come to advisory committee and then when they go to council. And so I think that is an issue that we are seeing at the staff level as well, and I think is connected to some of the other concerns that are on the agenda today regarding engagement and advisory committee being able to see all of the reports that they go to council. The lag time that we're seeing between advisory committee and council is about a month at this point, which can be challenging when we're working under very constant, tight timelines. Okay. And then Councillor Van Passen, if you have any other additional information that you wanted to provide in terms of bringing forward, or if I've misrepresented what your concern was, please let me know.
Go ahead, Councillor Van Passen.
Thank you, Mr. Chairman. I think Heidi has summarized it quite well. Last year, Norfolk County went to more of a steady cycle of, the first Tuesday, second Tuesday, third Tuesday of the month is council. And it's that same lag from the advisory committee. It's a month or more from the time that we deal with it before it gets in front of council. So I'm wondering whether if it would be possible to shift this committee to the first Monday of the month. It'd be able to go to council in committee with Norfolk on the second Tuesday, approved by council on the third Tuesday, and we can deal with these time-sensitive items. There's a lot of items I think that Norfolk County Council has dealt with because of the timing before they actually saw the input from the advisory committee. And, that's not the way it's supposed to be. So I'm hoping that we could look at adjusting the schedules.
Okay, questions, comments, Councillor Corbett?
Yes, and I think Heidi hit the nail on the head for the lack of input from this committee to council. And I agree with Councillor Van Passen, and if we can have it on the first week of the month, I'd be fine with that. I do know that the first of the month that involves a lot of those dates where we have to move them elsewhere, but perhaps staff can come back with a indication how we can accomplish that. The main thing is to get input from the committee so it can deal with it at council. I think it's a great idea.
I do too. I think it's a great point. Heidi, what are you proposing here, to put out a revised schedule to committee and see if there's any concerns, comments about the dates?
Yes. So, Mr. Chair, just a couple of points on this. First of all, I want to reassure committee and that any of the that I understand the concerns about engagement, and that I have great respect for the role of advisory committee, and anything that has gone directly to Norfolk or to the Board of Health. There has been no ill intent in that. There not an attempt to exclude our colleagues or councillors in Haldimand County. We are working under incredible timelines right now and time crunches with an intense workload. And so we're doing our best to keep the business of health and social services moving as quickly as we can. And have we dropped the ball sometimes lately? I full on admit that I have dropped the ball sometimes lately, and you have my apologies for that. As I've said to staff and to members of council recently, I am always open to feedback and improvement. And I think that this scheduling change could certainly assist with that. My suggestion, Mr. Chair, is that I'm hearing clearly the feedback from committee that the first Monday of the month might work for committee members. If I could take that back to Haldeman County staff, to Kathy Case, and to Teresa Olson, Norfolk County Clerk, to get their feedback, and then we can confirm with an email to committee and a revised schedule.
Okay, thank you, Heidi. Councillor Taylor, did you have a question?
Yeah, actually, that last comment just cleared it up. I was just going to say, I don't think we needed to come back to next meeting. We can certainly do this over email and you know, get ahead of it by a month too. So, yeah, that last comment there cleared everything up. Thank you.
Great. Okay, then Heidi, we'll move on to the next item, which is the advisory committee role.
Mr. Chair, this was an item that was brought forward by Councillor Corbett. I'm not sure if we've addressed it with the previous agenda item, or if there are other comments or questions that anyone would like to make.
Councillor Corbett?
I'm satisfied with the preamble that Heidi has given us with regard to the getting our input, and I think Councillor Van Passen has spoke to it. You have to get the information beforehand to go to council, and it's understandable in terms of we sit here sometimes 4 or 5 hours, and if you're not interested in our input, as Councillor Patterson says, what's the sense of being involved? Thank you.
Okay, thanks, Councillor Corbett. Any other comments? No, then we'll move on to the Health and Social Services Manager hiring process.
Sorry,
Tony,
Mr. Chair, I see
people have their hands up.
I see hands from Councillor Van Passen and Councillor Patterson.
Sorry, missed you, Chris. Go ahead.
Yes, thank you, Mr. Chairman. Just to let Mr. Corbett know, or Councillor Corbett, this has been discussed in Norfolk as well, and quite some time ago, about changing the structure of the Board of Health, but that's all provincial legislation from the Haldeman Act and the Norfolk Act in 2000. We were also going through the provincial sort of restructuring of the health units, and I think it's still in play, because then COVID came along and we've had other priorities. But I think we're all on the same page that if you know the health unit serves 2 counties, it should be represented by 2 counties, and I'm hoping we will get there sooner rather than later. But as soon as COVID is done, I'm sure we'll get back into that review. So it's not like Norfolk is ignoring the whole situation. We recognize the inequity as well.
Okay, thanks, Councillor Van Passen. Councillor Patterson.
Thanks, Chair Del Monte, and apologies. I had problems with my computer. I had to dig out the laptop, so I missed the bulk of the conversation, but it sounds like you guys have addressed the elephant in the room, so I'm happy with that. And again, sorry for missing 5 minutes of the conversation.
Okay, thanks, Councillor Patterson. And I'll go back even a little bit further, Heidi. I'll go back to the time when we had regional government, and I was on the last term of when regional government sat. And you remember one of the comments that regional council made to the province was, if you're going to cut the cord on dividing the 2 counties, the umbilical cord, cut it all the way. Instead, they didn't do that, and they left us joined with Health and Social Services as one body serving 2 counties, but it was Patty Moore, former general manager, who suggested that in order for Haldeman to have some input, let's set up this advisory committee so that Haldeman has a voice on various reports. Perhaps at that time, that's when the decision should have been made to appoint some Haldeman councillors to the Board of Health, and problem would have been solved a long time ago. So I'll point the finger at the province on that one. That's the way it transpired, rightly or wrongly. Here we are today, and we're trying to. Anyhow, any other comments on that issue? Okay, then we'll move on to the Housing Corporation Regen Study. Heidi?
So thank you, Mr. Chair. So this is an item that we've been having discussions about. I assure committee that this is a project that has had considerable time and attention from myself and other staff within the department. As you can see, that there are considerable competing priorities within the department and significant initiatives happening, such as the two that we've already discussed, the overhaul of social assistance and the community safety and well-being plan. So yes, the original intent was for the regen study to be in front of you today. However, in thinking about the process, some other things have come to my mind. First of all, the two reports that have been submitted in draft total over 100, almost 170 pages. And so for that sizable report to go through the usual reporting process, I don't think, my suggestion is, does not give a lot of time to staff or to council to review those kinds of documents before we discuss them. So if for example, we had gone with the report coming today, you would have gotten it at end of day Thursday for discussions on Monday. And they're sizable documents with a lot of information. The other issue is that looking at how we can get all of the information to both councils so that everyone has equal access to the same information at the same time. Presenting the report 3 times doesn't accomplish that goal and is not terribly efficient. To present it at advisory committee and present it at Haldeman and present it at Norfolk. So rather than going to advisory committee and then to each council's, my suggestion to the CEO of the Housing Corporation and to Kathy has been that we consider these reports at the Housing Corporation annual general meeting, which could double as a shareholders meeting of the Housing Corporation and is already tentatively scheduled for June 15th. Looking at the way our meeting schedules go, if the regen study had come to advisory committee today, we would have been in the same situation that we have been, where it's going to councils in June, or councils in committee in June, and then final ratification by Norfolk Council in July. I think that addressing this issue at the Housing Corporation annual general meeting when both councils are present is similar to the way that we did the shareholders agreement, allows for discussion with everybody at the table at the same time. And then if there are proposals, which I know that there are for new development for each county, then each council can deal with those separately. So that's the discussion that's on the table right now. It's not about delaying decision on this project. It's about presenting it in a way that everyone has access to the same information at the same time, and that everyone can have a fulsome discussion about the future of housing in both of our counties across our whole system. So with that, I'd be happy to answer any questions.
Okay, I have Councillor Corbett.
Thank you. You've given us a path and I accept that, and I'm quite sure you're aware that anxious to get going on to address the affordable housing 0% vacancy rate in particular in Haldeman County. And what I'm concerned about too is I see other municipalities getting or able to get grants, and we want to be in a position where we can have something shovel ready to take advantage of the grants. And this is most important to our council too. In moving ahead, they're looking at grants to go forward.
Heidi, I would have thought it would have been nice to have this at an in-person joint meeting, but I don't know whether that's gonna whether that's going to happen or not soon. I guess we'll wait to hear in a few weeks. But anyhow, Councillor Corbett's points well taken, and thank you for the update on that issue. Are there any other questions or comments? Councillor Taylor's.
Sort of along the lines of what you were saying there, Tony, is just maybe we could find a venue that could hold us if the stay-at-home order is lifted, just so we have that option. Again, I think this is a good in-person one, but if it's the cards we're dealt that we got to do it online, that's the case. But I think we should be prepared with a potential venue to hold it in person.
Okay, thank you. Any other comments? Okay, Heidi,
So,
is there
Mr.
any?
Chair, if I can just interject and confirm next steps. I see that I have email correspondence waiting for me from Matt Bowen and from Kathy, so I will follow up on those today, and we will move forward looking to the annual general meeting for the Housing Corporation, and we will endeavor to get the reports out to council well in advance, at least I would think at least a week in advance, so that you have adequate time to review the volume of information and digest it.
Okay, thank you, Heidi. Is there anything else, Heidi, to bring the committee's attention today?
We were to deal with the service manager hiring process.
I thought we did that. No?
No.
Heidi? Okay, go ahead, Heidi.
So, Mr. Chair, at the last advisory committee meeting, I was asked about the status of the medical officer of health recruitment and had reported that there was a posting and that we were working with Norfolk County HR on that recruitment. Since that time, within the last week and a half, it's been brought to my attention that there was a policy from 2001 that articulates what a hiring board is supposed to look like for senior leadership positions within the Health and Social Services division. I was not aware of that policy, and in reviewing all of my files from the transition board days, I actually don't have a copy of it physically here in my office. I have now been given copies of both Haldeman's policy and Norfolk's policy, and there is an open session report at the Board of Health meeting tomorrow evening to strike an interview committee for the acting medical officer of health position that includes counselors from Haldeman and from Norfolk, with support being provided from myself and Haldeman's general manager of corporate services. So now that that has been brought to my attention, we've worked as quickly as we can to rectify that situation. And again, my apologies. It was just not something that I was aware existed, to be very honest.
Okay, questions? I have Councillor Corbett, then Councillor Van Passen.
Thank you. I believe Councillor Van Passen was first, if he wants to go first.
Go ahead, Chris.
Yes, thank you, Mr. Chairman. Just to hopefully alleviate some of the concerns from Haldeman councillors, yeah, we did recognize this little flaw. We have scheduled a special meeting of the Board of Health to set up a joint committee to review the applicants for the medical officer of health. That can be immediately put into place so that we are going to get the input from both sides. So, yeah, I was not aware of this, but this is the kind of thing that we look to members like Bertie and Mike Columbus that have been here since day one. They're supposed to remind us of these little things, but we're trying to get it in place so that there will be input from both counties on the hiring, and yeah, we will make sure we keep this policy in place when it comes to the senior management levels at the health unit as well. So we're working on it again. So I apologize for the error on our part, but we're trying to remedy it as quickly as we can. So
Heidi, just so that you know, that meeting tomorrow afternoon at 1:30, I cannot make it. I'm tied up with a committee of adjustment meeting that I made a commitment to months ago, and the times are just not going to work out for me. So I'll say that now, if Councillor Corbett or Councillor Patterson want to take part in my place, you're more than welcome, or staff. Lori, if you want to, by all means, but I looked at the time and it's just not going to work for me. I know the mayor has been invited. I believe he's going to attend. I just wanted to let you know that. Councillor Corbett?
Yes, thank you very much, and thank you, Chris, for acknowledging it. It is a concern for us that we have the input in the hiring. And I put in the information that I've provided, and I know Tony and I sat on hiring previous medical officers of health, but we have a feeling, and Tony can speak for himself, perhaps Stu can put in, is that with regard to Haldeman, we have delegated the authority for hiring staff other than the CAO to our staff, and I'd like to see that, to have that involvement of our staff who make the recommendation. And I'd like to see that in particular with Haldeman, that our CAO looks into who they put on, whether it's HR people or Kathy, general manager, to do that in place of counselors. Because again, counselors do not get involved with hiring other than the CAO.
Heidi, I echo Bernie's comments. I was on the committee, invited to the committee that hired Shanker. But at the end of the day, and this is just my opinion only, in today's environment, it was HR who really came up with the questions. And really, you've got counselors sitting there asking those pre-prepared questions. And, it's interesting to see the response from the candidates. But at the end of the day, you know as well as I do, in today's environment, you've got to be very careful about what questions you ask and what you say to those candidates. You have to be careful more than ever. And I really feel it's best handled, this is my opinion only, it's best handled by HR and by staff. And I concur with Bernie. We should only be involved with the hiring of a CAO when necessary. That's my opinion. Anybody else? Councillor Huffman?
Thank you, Chair Del Monte. I concur with you. I believe that this is a HR issue and we need to stick with the mandate of council, and council should only be responsible in terms of being involved with the CAO hiring. This is an HR issue, and I support your position thoroughly.
Councillor Van Passen?
Thank you, Mr. Chairman. I think that we might do a bit more homework on that with the position of medical officer of health, since it is mandated by the province. And in a lot of cases, most cases, they actually act like a CAO. But I agree with the principle. I would consider that the two CAOs should get together and look into all the senior staff but the medical officer of health, I think, might be a little different because of the legislation. And I'm sure Heidi can check into that and let us know. But I agree with the fundamental principle that you're bringing forward. So,
Heidi?
Yeah, thank you, Mr. Chair. Certainly, I can look into the legislation related to that prior to the Board of Health meeting tomorrow. And I just wanted to note for the Haldeman members that I see that our Norfolk Council members have been taking note of the comments and suggestions, and so that feedback can be brought forward to the board.
Thanks. Councillor Corbett, do you have another comment? No? Okay. Okay, so Heidi, I'll ask, is there anything else you want to bring to the committee's attention today?
I don't think so, Mr. Chair. I believe that that Haldeman councillors were provided with a closed session update at a member of at a recent meeting of Haldeman Council. So if there are any questions about that, we would need to go in closed session, but I don't have anything else today.
Okay, very good. Then we'll wait to hear from you on a revised schedule for the advisory committee. Okay, then I guess that's it, and we're adjourned. Have a good day, everyone.
Bye, everyone. Thanks.
Thanks, everyone. Have a good day.
Goodbye, everybody.
Take care.
Bye.